The following is a paid advertisement of St. Anthony Hospital Orthopedics. References to any specific product, services, or entity does not constitute an endorsement or recommendation by St. Anthony Hospital, Carroll Broadcasting, or its advertisers. The views expressed by the host or guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Welcome to the St. Anthony Hospital Orthopedic Show with Dr. Richard Godding. Dr. Godding specializes in joint preservation, reconstruction, and replacement surgery, and brings over 25 years of orthopedic excellence to St. Anthony Hospital and to the Carroll area. For more information about Dr. Godding, his practice, or St. Anthony Orthopedics, go to santanthonyhospital.org or make an appointment by calling 712-794-5536.
Good Sunday morning, Iowa. It is Dr. Rick Godding, and thank you for choosing to spend some time with me here this morning. Boy, it's just been brilliant fall weather. Again, I'm recording on Monday, and it was a brilliant weekend. By the time you hear this on the next Sunday, it could have turned, but it looks like it's going to hold out and have a pretty decent string of weather for us. Pumpkins are out, meaning the pumpkin stands are out, in the parking lots and things like that, and the mums are out, and it's fully fall, and I think pretty soon here will be the last day of wearing shorts and or short sleeves, so go enjoy it while you can. Get out there and get some sunlight on you. You need to stock up on sunlight, and if you live in Iowa, you should take vitamin D probably all year, but certainly in the winter. Vitamin D is good for your bones, but it's good for lots and lots of physiologic processes in your body. And as a matter of fact, we screen our patients before surgery to make sure that their vitamin D levels are acceptable, so that some of the data has shown that a low vitamin D level in your body can increase your susceptibility to infection after a knee replacement. And of course, we do everything we possibly can to avoid infections. And Dr. Dirks and I have a below the national average infection rate that we're proud of. So, but that's just one of the things that vitamin D does for your body. Obviously, it helps with your bones. Everybody has probably heard that from forever. You're likely not drinking enough vitamin D fortified milk to get all the vitamin D. It's just real easy. And the thing is, here's the thing. If you're over 50, I'm going to guess a lot of the people listening right now are over 50. You take a Centrum, or I don't want to plug any particular, but a multivitamin. Those are going to have sufficient vitamin D for you. They're also going to have all the other things you need, vitamin C, potassium, zinc, all these things that you need. There's actually data that shows that people who take a multivitamin every year have a lower chance of Alzheimer's dementia. And now, there could be other factors. I mean, it's very hard. These studies are very, very hard to control, because if you're asking one factor, well, I would guess that people who are aware enough of their health to take a multivitamin every day are going to probably eat better, and maybe it's more likely that they're going to exercise and things like that. So it's really hard. I mean, science is very, very difficult to get right. And on top of that, you have to look out for biases, because everybody doing science has biases, because all human beings are biased. Like me, I'm biased, you're biased, everybody's biased. And that doesn't mean you're biased in a way that's mean or bad or anything like that, but you have certain things that you think, and that's what's called a bias. And so when you do a scientific study, those biases can come through. I've done enough research both in the laboratory and in the clinical setting to know that, people are people, human beings are human beings, and biases can be reflected. Nevertheless, I'm getting deep in the weeds on scientific investigation and bias, but the reality is it costs nearly nothing. I think Centrum costs less than $1 a day. Again, I don't want to say Centrum, it's just the one I take. And if you can take some vitamins that you may or may not be getting in your diet, and it can help you in the long run, I don't see a reason why you wouldn't want to. And in that vitamin, in that multivitamin, would be enough vitamin D for you to not be deficient. And again, I'm talking about vitamin D because guess what? Fall's coming, days are getting shorter. You're going to go outside and only your face is going to be exposed, and that's going to be on a very limited basis. So you're really going to get zero vitamin D from the sun pretty soon. That is our main source of vitamin D. It's the healthiest way to get vitamin D is to go out with your shirt off in the summer. Not get burned, but just get some sun on you. But given that we're entering that phase of the year where that's not possible, I would just highly recommend just take a multivitamin every day, and maybe that will remind you to eat a little bit better. Don't have a multivitamin and then a McDonald's sausage, egg, and cheese biscuit with hash browns. That's not how you start your day healthy. As I age, I'm 55 now, and as I age, I am two things. One, I wish I'd have taken better care of myself earlier, but two, that doesn't matter. And I've always exercised, and I've always kind of struggled with my weight, but I like pizza. Listen, I like pizza. And not just pizza, but I like French fries and things like that. So I've always struggled with the eating aspect of it. But now that I've been doing the carnivore diet almost 2 years now, I'm still down about 35, 40 pounds from where I started. The lowest I got was another 15 from here. And so it's hard, and especially with my kids, two teenage girls who, I can tell you, if you have found a way to have your teenage kid eat healthy in this society, you are on a different level. I have been unable to do that. We feed them healthy meals when we feed them meals, but then they're out, they love to run and get energy drinks, and they love to get different fast foods, and a lot of Cane's fried chicken is quite a fan favorite with the kids, and of course they love pizza. And it's hard because it's just hard. But as I've aged, I've paid more and more close attention to my health, and I've been doing more and more working out and eating right and things like that. And I think that it makes a big difference. And even if you're in your 50s or 60s or even 70s, it is not too late to start taking good care of yourself from a health perspective. So that's just what I would say is take a multivitamin, watch what you eat, get a little bit of exercise. And like I said, vitamin D has been shown to reduce infections after a joint replacement. Infections after a joint replacement are things that really worry us. And when they happen, they can be a big deal. You have to do some pretty significant things, depending on how long after the surgery it's been by the time the infection is diagnosed. And I would just say that anything you can do to hedge against that is good. And so what we do, so our infection protocol, Dr. Dirks and myself here at St. Anthony's, we screen for the vitamin D. We make sure that a patient meets certain criteria with respect to their underlying medical conditions. So one of the things is if you are diabetic or pre-diabetic, there is a marker called the hemoglobin A1C. Now, the hemoglobin A1C is a long-term look at how much sugar is flowing through your blood. You shouldn't have a lot of free sugar in your blood because you shouldn't have too much of it, I should say, because if you have too much, then what it can do is it binds to your hemoglobin, which is the part of your blood that exchanges oxygen. So the function of a red blood cell, there's white blood cells, there's other things going on in the bloodstream, but the red blood cells are the ones that take oxygen. So you breathe it in. It comes into your lungs. It goes from the veins to the small capillaries. There are capillaries in these little areas of the lung called alveoli, and that's where you will breathe in your oxygen, and then the carbon dioxide that has built up goes out. Well, the carbon dioxide builds up from your cellular metabolism. So the cell is going to take oxygen in, it's going to do chemical processes to it, and the waste product of that is carbon dioxide. And the carbon dioxide is then going to go out into the lungs through that exchange from the red blood cell and out into the air and breathe it out. Now, when you have too much glucose in your bloodstream just floating around in there because you've eaten too much or you're not metabolizing it well, then the exchange of oxygen at the tissue level, so you breathe it in, the red blood cell, you just think of it this way, it puts oxygen let's just say in a pouch. It's not a pouch, but it's a chemical bond. And it goes to, let's say, your liver, your toes, your kidney, whatever it is that is one of your parts of your body that needs oxygen. It goes and it deposits it through what we call capillaries. So the capillaries are the smallest blood vessels. There's basically one cell going through there at a time, essentially, and then that cell will, at that level, it will engage with the wall of the capillary and distribute the oxygen that each of the cells of your body needs to live. So the red blood cell is the transport oxygen from the lungs down into the tissue, and then picks up the carbon dioxide that the cells have produced by using the oxygen. It breaks it up, and then it has carbon dioxide, and it puts that out as a waste product, and then that goes back through the bloodstream to the lungs and then blows out. So the exchange of oxygen on the tissue level, when I say tissue, anything on your body, any part of your body is made up of tissue. Like skin is a tissue, there's heart tissue, the eyes are tissue. That's just kind of the general term we use to describe the substance of your body, if you will. So there's heart tissue, lung tissue, brain tissue, skin tissue, bone tissue, all that. So those are all dependent on getting oxygen delivered to them. So the hemoglobin is what distributes that oxygen from the red blood cell. That is the component within the red blood cell that it distributes the oxygen and the carbon dioxide. And if you have too much blood because your sugar has not been controlled through diet and exercise and or medication, then your hemoglobin A1C is the number that we check. Now that hemoglobin A1C, once it's past the number of 7, so it's just a level, it's like a number, and once it's past 7, your rate of infection after a knee replacement is higher. So we have our patients get better control of their glucose. We're talking now about what do we do to make sure we don't get infections with joint replacements. So you get your hemoglobin A1C down below 7. Body mass index is another controllable factor. We're talking about what we do is before the surgery, we control all the patient-related factors that we possibly can. If your body mass index is above 40, it's known to be a higher rate of complications, both infectious and other. So this is another patient-controllable aspect of your preoperative care. So you will need to lose weight and get your sugar under control. Okay? Then what we do is we have you bathe with a Hibiclens solution. Hibiclens is the same solution we're washing our hands with before we do the surgery. You'll bathe with that for a week prior to your joint replacement. Once you get into the operating room, first let's talk about the structure of the operating room. At St. Anthony's, we have what's called positive pressure ventilation. So what that means is if you're sitting in a room and there's a vent on the ceiling, it's just kind of blowing it out, and that it blows all around the room in circles and whatever. Well, if there's any bacteria floating around in that room, and bacteria can float, it could cycle by multiple times and have many chances of landing in the knee during the surgery. So what we do is we have this positive pressure ventilation. This is a system that St. Anthony's installed, and it blows everything in one direction. So it comes down from the ceiling and out under the doors and the vents on the floor. So it's all just one direction. So you don't have any recycling of that air, thus reducing the chances that a bacteria that's on a shelf somewhere or on someone's shirt or whatever else, even though we try to control all those things too, the positive pressure ventilation. So we get our patient tuned up properly. We make sure their vitamin D is proper, their weight is proper, their hemoglobin A1C is proper, any of their other medical problems are taken care of. You wash for a week with the Hibiclens solution. We have positive pressure ventilation. Once we get into the room, we wear these space suits, which are basically contained, so everything we're breathing out and everything is going out down towards the floor. And we obviously prep the skin. We prep the skin with the Hibiclens solution again, and then there's another different sort of a paint that we put on it. And then we drape it, so the drapes are all packaged sterilely, and so we have a drape around the leg. So then the leg, I'm just talking about a knee here, so it would be the same for the hip, but we're just talking about a knee. So the leg is draped out, and then we prepped it. Then we, are using very meticulous technique during the surgery. There's things like I don't grab onto the skin with our hands, and we use instruments and those kind of things. Then I will use 2 separate washes. One is just another Hibiclens solution wash. We really like that stuff. It kills the bacteria on contact. Then I'll wash that out. And before that, we've given some intravenous antibiotics. They'll put a catheter in your arm, and then we'll put some antibiotics in before we make the skin incision. Then we wash with this Hibiclens solution, and then there's a second solution that is an antibacterial solution that we use, and that has a property that doesn't allow bacteria to attach to anything. So again, keeps it moving along so if there is any bacteria at any given point. And bacteria can come into the knee after the surgery from different things, if you have an infected toenail or things like that. But during the surgery, we are washing this with an antibacterial solution times 2 different antibacterial solutions, and then put some powdered antibiotics in the joint before we sew it up. And so that is our infection protocol. That's how we keep from getting infections. And so it becomes, you want to select patient selection. You want to get the healthiest patients you can. And then you got to get the patients that you're going to operate on to be as healthy as they can be. And you want to control their weight. Obviously, I didn't mention, but smoking cessation. You'll need to quit smoking if you want to have a joint replacement. You need to get your weight under control, your sugar under control, any of your other medical problems under control. You will then, again, bathe for a week with a special solution. We will give you antibiotics before you go into the surgery room that has a special type of ventilation. We wear special suits. We drape you, prep the skin, use meticulous technique, lots of washing out, and then 2 separate antibiotic solutions that kill bacteria on contact. The first one kills them on contact. The second one kills them on contact and prevents them from even attaching to anything. And then we put some antibiotics in the incision at the end. And that is how we keep our infection rate low. And like I said, we have a lower than the national average, which is somewhere around 1.5%. Dr. Dirks and I, our total joint infection rate is lower than that because we keep tabs on it. We monitor these things so that we know if there's any aberrations. Although it's a small hospital, so we know if something happens. But that's kind of it. I got started talking about that because of vitamin D. Vitamin D is something you want to take on a daily basis. You can just take a multivitamin that will make you overall healthier. And then that kind of led into my conversation there about, its relationship to post-surgical infections. And so if you are going to get a knee replacement somewhere other than St. Anthony's, they may or may not be looking at your vitamin D level. Just start taking them out in multivitamin. Your surgeon will not have a problem with that. If you know you're going to have a knee replacement in a few weeks or months, just assume that if you live in Iowa, you have a very statistically high chance of having a low vitamin D. You can even take vitamin D too on top of the multivitamin. But it is something that, is not on the radar of some people. And for me, my mother-in-law back a long time ago had an infected total knee. I didn't do the surgery. I didn't participate in her care in that way at all. But I saw how difficult they can be, and so I've always been super, super meticulous and very vigilant, shall we say, to make sure that I'm doing everything I can possibly do to make sure that we don't have an infection. And we've been very successful with that. And that's why I think all surgeons really don't want infections. I think surgeons who have had a family member with an infection have maybe an extra motivation. But yes, if you're going to have your knee replaced, hip replaced, shoulder replaced somewhere else, take some vitamin D beforehand, take a multivitamin. It's not a tough thing to do. It's not hard. I also give my patients probiotics, and those have been shown to reduce infections. I also give my patients essential amino acids, and those have been shown to just kind of help you with your overall recovery, not having anything to do with infection. But yeah, stay healthy, get healthy, use these last few weeks to get yourself as healthy as you can before, as we know, the winter comes and everybody seems to pack on pounds. And I understand, holidays are coming, but just try to keep it under control, keep yourself healthy, because before you know it, it'll be spring and you'll want to be healthy again and out moving around. So with that, thanks for joining me, and you have a blessed week, Iowa.
This has been the St. Anthony Hospital Orthopedic Show with Dr. Richard Godding. For more information about Dr. Godding, his practice, or St. Anthony Hospital Orthopedics, go to www.santanthonyhospital.org or make an appointment by calling 712-794-5536.